all. Hope you're doing good, and today we are going to discuss about preventive psychiatry. Before going to the topic, I will tell you what's the meaning of health and what is the meaning of mental health, or what's the difference between health and mental health. Health means a state of, or it is a state of complete physical, mental, and social well being, not merely the absence of disease or infirmity. This is the WHO definition, that means World Health Organization definition of health. Then, what's the meaning of mental health? Mental health means an ability to maintain a balance between individual and his or her surrounding. Or simply I will tell you, it's an ability to maintain a harmony between you and your surrounding. So this mental health is very important for us, or very much essential for us to maintain a normal life as a normal social being. There are three aspects of care we can see in this mental health. So there are three aspects of care to maintain this normal mental health. First thing is treatment for the particular disease condition. Second thing is prevention of the particular disease condition, and rehabilitation. That means what? Restoration of the complete physical, mental health of the person after discharging from the hospital. So these are all the three aspects of care we can see in mental health. Now we will see the levels of prevention. That means the topic which we are discussing today. These three kinds of interventions we can see here. They are interrelated but independent from each other. That's the speciality of this prevention, levels of prevention. There are three type of preventions are there: primary prevention, secondary prevention, and tertiary prevention. Well, seeing we'll feel it's same, but it is interrelated of course, but independent from each other. Based on the literature, that means based on the studies, based on the review of some researches and journals, we can say that macroscopic perspectives might help to practice mental health promotion as well as illness prevention. So that's what I've told you. They are interrelated each other. They are related each other, but independent from each other. So a macroscopic perspectives of study, macroscopic or detailed study or detailed observation, we need to understand the difference between this primary, secondary, and tertiary levels of prevention. So these are all the three types of psychiatric preventions we can see: primary prevention, secondary prevention, and tertiary prevention. Now we will see what is the prevention, or what is the meaning of prevention. The main aim of preventive aspect is to keep people healthy or become even healthier and enhancing individuals' ability to achieve psychosocial well-being. So what's the aim of this preventive aspect of health, or what is the meaning of prevention means? What? Keep the person healthy, or become even healthier and enhancing the individual's ability to achieve psychosocial well-being. And prevention focuses on causes or etiology of psychiatric illness to avoid illness. So the prevention or preventive aspect is mainly focusing on etiology of psychiatric illness to avoid psychiatric illness. A pin need to keep it on mind that promotion and preventions are interrelated and overlapped. Another point which we have to think is promotion and prevention. These 2 points are interrelated and overlapped. Therefore, mental health promotion involves different activities for prevention of mental illness. So, I've told you this is interrelated and overrelated or overlapped. So, we can say mental health promotion involves different activities for prevention of mental illness. So, the aim of this prevention means the aim of this preventive aspect is to keep the people healthy. Simply healthy, or become even healthier and enhancing the individual's ability to achieve all well-being, psychological well-being and social well-being. Now we will see what is primary prevention. I've told you already, all the prevention, that means primary, secondary, tertiary preventions are interrelated, but they are independent. So now we will see what is primary prevention. This is the initial stage of prevention which focus on modifiable risk and protection factors to minimize severity of disease condition. So primary prevention is focusing to modify the risk factors and how we can minimize the severity of the disease condition. Primary prevention practices take place across different health settings, and financial support also will get from government under these various schemes. So primary prevention we are practicing in general health services as well as in mental health services, and we are getting lot of financial support from the respected government under various schemes for this primary prevention. So this primary prevention is focused on modifiable risk and protection factors to minimize severity of the disease condition. So whenever we see a disease condition, first we will start with primary prevention. An example I will tell you, home visitation under district mental health program for mental health awareness program. So home visit, that means the primary prevention. Through home visit, we will give health education to the people to prevent the occurrence of the condition, to oppose the occurrence of the condition. So home visitation, that's the first stage to prevent the occurrence of the condition. So home visitation is example for this primary prevention. So this prevention which focus on modifiable risk and protection factors to minimize the severity of disease condition. Okay guys, so this is primary prevention. I will tell you some example. If you see this example, you'll get more understanding about what is primary prevention. Psychological support. If you give psychological supports or psychological education to a person, to some extent we can reduce the entry of different kinds of disease condition. Next is parent skill training. If a good parent is training their children in a proper way, means lot of childhood psychiatric problems we can stop. Then clinical mental health counselor support. Clinical mental health counselors can give clinical mental health counseling to the person, and we can prevent the entry, or you can prevent the risk of mental health illness. And health education. So these are all the primary preventive aspects of preventive psychiatry. Then we will see what is secondary prevention. It is the second stage of prevention which aims to reduce the progression of mental health disorders. So already happened. So during that time only we will focus on secondary prevention. Already disease is there. Okay. If disease is there and that time if you are giving treatment to prevent the or reducing the severity of the condition, means or reducing the progress of the condition, means that is known as secondary prevention. Okay guys, and these primary care providers are giving these services like screening for behavioral health problems such as depression, anxiety, trauma and substance abuse. So primary health care providers or the doctors or the nurses are working in the secondary preventive aspects. So secondary prevention means it is a second stage and which aims to reduce the progression of mental health disorder through screening, early identification of disease and few treatment modalities. I will give you some example, then you can understand easily what is secondary prevention. Provide medication. When we will give medication to the patient, after the patient comes to the hospital or admitted in the hospital, or if they come for a consultation, that time only we will give medication after diagnosing their condition. So secondary prevention is taking place after diagnosing the condition. And after diagnosing the condition, depend upon the condition, we will give various health education therapies to the patient. That is an example for secondary prevention. So again, I'm telling, it aims to reduce the progress of mental health disorders. Then we will see what is tertiary prevention. This is the third stage of prevention which aims to improving the functioning, minimizing the impact of illness. So it improves the function as well as minimize the impact of an illness. So this is the last stage, means after treating the condition, tertiary prevention will help to prevent the reoccurrence of the condition. So primary prevention prevent the occurrence of the condition, secondary prevention will reduce the progress of condition, and tertiary prevention prevent the reoccurrence of the condition. I will tell you an example: outpatient treatment, home-based care, rehabilitative services. These are all the example for tertiary prevention. So we can conclude that primary preventive measures are using for mentally healthy persons exposed to special mental health problems. Secondary preventive psychiatric measures are using for early detection and treatment of psychiatric disorders. The secondary prevention is the heart of preventive psychiatry. I feel that is the heart of this preventive psychiatry because this is already present, right? This is already present in the peak level during this level of prevention. So it is the very important aspects of prevention, and tertiary prevention is the rehabilitative prevention rather than truly preventive. So these are all the three aspects of prevention. Primary prevention, prevent the occurrence of the condition. Secondary prevention will reduce the progress of condition, and tertiary prevention prevent the reoccurrence of the condition. This is about psychiatric prevention. Hope you understand. Thank you.